Welcome to the Age Gracefully Show with Dr. Michael Grossman, the well-known anti-aging stem cell and regenerative medicine specialist, best-selling author, and founder of the OC Wellness Clinic in Irvine, California. Each week, he shares the latest information to help you look and feel your best so you age gracefully. And here's your host, Dr. Michael Grossman.
I'm Dr. Michael Grossman. I'm an anti-aging physician located here in Newport Beach, California. My website is ocwellness.com. I've been an anti-aging physician for many years, 1976. So I work in this arena of anti-aging medicine, and it's so fulfilling. This is the area of cutting-edge medicine where we work at keeping people youthful and healthy as they age. And there's so many parts of that integrated approach to make it happen. There's so many things you need to do from your side. You got to eat healthy, you have to think healthily, you have to be able to sleep in a good way. And there's so many things to do that is your responsibility. But there's certain things that are my responsibility as your physician. Yes, I have to tell you about all the good things you have to do, but there are certain kind of injuries that don't heal well as we age. So let's think about injuries as we age. What happens when we're a youthful person? We're 10 years old, we hurt ourselves. It usually heals pretty well. Whatever the injury is, we usually heal it. Now, as we get older, then things don't heal so well. And the things that don't heal well in terms of joints and tendons and ligaments are a specific kind of a problem. When you injure your skin and you get a cut in your skin, it's going to heal whatever age you are. It's pretty much going to heal. Now, sometimes if your circulation is really bad in your legs, it will never heal because you don't have any circulation there. But for the most part, you injure your skin, you get a little scar there, but it heals and it's fine. You don't have to work too hard with it. Why does the skin heal so easily and not so well in the tendons, ligaments, and cartilage in the joints? Well, tendons and ligaments and cartilage is a very, very, very thick kind of substance that has to hold things together really, really well. So your tendon in your biceps and in your arm, it's really thick and strong, like a heavy rope that allows the muscles to pull against it, and the tendon inserts into the bone and holds on to the bone. So it's a very, very thick substance. You injure the muscle, it'll heal, and usually heals pretty well. It sticks together and it repairs itself pretty well. But the tendon or a ligament is so tight, there's no blood vessels in it. It gets its nutrients just from the surrounding area, just sort of floats through it. There's no real blood vessels there. In the muscle, there's lots of blood vessels, and you cut it, it bleeds a lot. But the tendons, ligaments, there's really essentially no bleeding because there's no real blood vessels there. And so the amount of repair possibilities in a tendon, the ligament, or cartilage is very limited. You don't get a signal to repair. Where do signals come from to repair? It comes from the bleeding. When you get bleeding in the body, the platelets clot and release a signal. Oh, there's an injury here. Let's repair this problem. So the clot, it forms like a matrix there to hold it together temporarily. And it says, okay, please repair this. Now, I'm holding it together, but I need for the stem cells and repair cells to come into the area and repair it and make it work. So that allows repair to occur easily in the skin. And then a lot of internal organs you can repair pretty well with that kind of an approach. But tendons and ligaments and cartilage, it's just so tight. So you have cartilage in your knee and in your hips and in your shoulders, and the cartilage kind of lets the bones rest on it, and it's like a cushioning there, but it's so tight, it's like a really hard rubber, and you just don't have blood vessels to allow the repair to occur. So what can we do then? What can I do as an anti-aging physician? A natural approach to let the body repair these areas that otherwise won't repair. When I say it won't repair, you can have people have tendon injuries for ages, for 10, 20 years, and it never repairs. Do you want to do surgery for it? Well, sometimes you need to do surgery. If you have a tear in a tendon and it completely tears off from the bone and the muscle is contracted, then you have to go in surgically and reattach that tendon to the bone and get it to stick there. Or if the tendon actually tore and some of it's in the bone and some of it's off, you have to sew the tendon up to itself to get it to stick. Mostly that doesn't happen. Mostly you get frayed, torn tendons and ligaments that are just partially torn and they're stretched and they're, instead of it being tight like this, they're kind of like stuck apart and they're just kind of wiggling around and they're just not attaching well. So what we can do is we can use this natural signaling the body has to repair things and stimulate the body to send in repair cells into that area. So we do that with platelet-rich plasma, we call it. So the platelets that are in the blood are just waiting for a signal. If there's an injury, I'll create the clot and I'll send off the repair signal. So what we do with the blood, we take like 60 cc's of blood, and then we have a process of spinning down the blood and separating the platelets out and concentrating maybe 5 or 10 cc's out of the 60 and concentrating the platelets. And then we can activate the platelets with usually some calcium, and it activates the platelets to go into that area and actually form the matrix of repair and signaling to the body, bring in repair cells. So we can do this in all different joints, in your knees, in your hips, in your shoulders, ankles, wherever, and signal the body to repair. And if that injury in the cartilage is not completely torn, it's just frayed, it will repair. And it's very helpful. It takes about 6 weeks to go through a whole process of repair. It's like a bone. When you break a bone, it doesn't repair right away. It takes about 6 weeks to repair. And that's about how long it takes to get the full benefit of one platelet-rich plasma injection. We can inject a tendon, a ligament. You can even inject a scar in the skin. Sometimes your skin scars up and it looks all out of shape and funny, and you can inject PRP and you get nice repair in the skin. And for people who have trouble repairing the skin because their circulation is really bad, it's a great, great way to get the skin to repair. Now, what happens if the tearing is pretty intense and your doctor says, oh, this is bone on bone, you're going to need to have hip or knee replacement or shoulder replacement? Mostly what that means is that the joint has lost a lot of cartilage, and instead of the cartilage resting on the bone, it's sort of really frayed, but you still have little pieces of cartilage there. The cartilage is sort of like mountains and valleys, and in the valleys the cartilage is still there, but on the mountains the bone is on bone. But bone on bone means that there is lots of islands of cartilage in between those mountains, and in the valleys, that cartilage will regrow. When it looks like it's bone on the X-ray or the MRI, what we suggest is either exosomes or stem cells. Exosomes are little growth factors, little packets, different than platelets. These are in the amniotic fluid of babies. And these exosomes send out signals to repair and grow things for the baby. And we can take these super signaling little packets and concentrate them and use that to inject into people. And it's very safe. There's no DNA from the baby, but just these little packets. And they're very, very helpful. The most intense process of repair is done by your own stem cells. And we can take stem cells from your own fat. And the body stores fat all over, and you think that the fat has no purpose, but there's a big purpose to the fat. The fat has stem cells all around it, and the stem cells are waiting for a signal. And when the signal comes in that there's an injury, the stem cells will wake up and swim towards that injury. And what we do is we take your own fat from the belly and or the love handle areas, and we dissolve the fat with an enzyme, and then the stem cells are left, and we activate the stem cells, and then we can inject the stem cells back into your own body. They're your own stem cells. They're waiting for a signal. Okay, what should I repair? And so we take these stem cells out, and we get millions of them, 100 million, 300 million, lots of stem cells. And these stem cells, once we activate them, we can inject them directly into the area that's been injured, knee, hip, ankle, shoulder, wherever. And we can also inject them intravenously inside your vein, and they go all over your body to repair your brain, to repair your heart, kidneys, but specifically to inject them into the joints, the cartilage, the injury. And we find that we get great repair. And the repair from exosomes and stem cells are not just for 6 weeks, but rather for 6 months, ongoing repair to really make that process occur. And I've had so many great successes. It's like 80% of the time, it's like a miracle. People have been told, oh, you need to have surgery. And I inject them with these stem cells, and 6 months later, they're a new person. They feel great. I've had one young man who was like 26 years old, had 2 knee surgeries, and they wanted to do a third one because his knees were like the size of a volleyball, and he could barely walk. And he came to me, and I said, well, I don't know how much it'll help, but it will help. We did his treatment, and he got 80 to 90% better. His knees went back to normal size. He could start exercising. He insisted on the second one because he was so much better after a year and a half, but he wanted to be 100% better. So I injected him again, and sure enough, 100% better. Stem cells are an incredible opportunity to utilize what's naturally in your body to repair and regenerate. So I encourage any of you who have injuries that don't seem to be healing, come in and see me. We can help and repair those areas. If it's just a minor thing, then we just use some PRP. We also have vibrational gains wave therapy we do for minor injuries. So come in and see me, talk to me, and see if it's something that could be helpful for you. It's a pleasure to talk with you all. You can go to my website, ocwellness.com. We have a lot of information there about the stem cells, and I look forward to hearing from you. Thanks so much.
Thank you for watching the Age Gracefully Show with Dr. Michael Grossman. Join us next week for another informative discussion to help you age gracefully. Be sure to visit us at ocwellness.com.